appreciate Dr. Dewan and Scott and the other and the team let me actually give this talk now instead. Every time I see ultrasound pictures like that, I wish I could get that. But when I put the ultrasound, it doesn't look like your pictures. I don't understand. My talk is called MIS or Mistake. And I'm going to spend about 25 minutes. I'm really going to focus on a few disease states because I need really 3 or 4 hours to cover everything we're doing right now. I've done a lot of research. I still do a lot of research. I'm currently working in a lot of studies for level 1 evidence and all these techniques. So you'll see more and more of that. I'm in West Virginia. We're going to be coming to Dubai December of next year for the first ISPN meeting. So you'll be one of the hosts and look forward to that. And I encourage you to come there after this meeting in November. But my journey's been kind of fun, right? I'm in West Virginia. We started with epidurals, and now we're doing neuromonitoring for minimally invasive techniques. And it's been a good journey, but the journey is just really beginning. So as I talked to the fellows yesterday, I think it's such an exciting time if we don't mess it up. If we don't mess it up. And how can we mess it up? We can mess it up a lot of ways. But I think the main thing is we have to know our scope of practice. And anybody want to tell me what this technique here is? I'm getting ready to show you. Anyone want to just kind of scream out for me what they're seeing here? It's a cervical chordotomy, right? C2, cancer pain. I mean, there's some of you in this room could do this. You wouldn't want to do this unless you'd actually had a lot of training. So my point is, that's a very quick, easy procedure, but you can paralyze someone. So I'm going to talk about a lot of things that seem pretty quick and easy, but it requires an ego that's going to let you not cross the line. But I want to tear down this wall. Some of you are in places where the surgeons and the anesthesiologists, physiatrists have had battles, turf battles, radiologists. It's terrible. We got to turn down the wall of barriers and talk about training, precept training, and what's really right. And that's where we're going to go. And that's where we're going. And I'll talk to you about that at the end.